had any feedback from the PEs about the project, or are you still kind of getting started?
Yeah, we've had a little bit of discussion about it, and it seems like they've enjoyed talking about it and having the conversations with the father figures that are willing to be involved with the discussions about self-care.
Mm-hmm. All right, wonderful, thank you. We will turn over then to Bethany Public Schools. Hi, Amy.
Hello.
How are you today?
I am great. Ours is very similar to Safe Cares that just went.
Yeah.
Yes. So I liked how they, let me share my screen first. I liked how they changed the theme every month. That's a good idea.
I like that. Yeah, I thought that was creative.
So I did come up with a different title. We had basically our topic for the title. So self-care is not selfish. And basically, like what you just heard, our main intent is to get the mother and father to both engage in self-care. And we want the fathers to engage with the child more. So we're still focusing on the father-child interaction. But what we thought was if the mothers could have some time for self-care, then that would be a good time for dad to engage with the children during some routine childcare activities, such as bedtime routines, feeding, things like that. But we also wanted to stress that self-care is also important for dad. So like Safe Care that just went, we are tracking if both parents are doing the self-care. My scroll button here. There we go. So our aim, SMART aim, is by engaging caregivers in self-care opportunities using parent-child activities, 15% of caregivers will report an increase in father engagement. So our weekly outcome measures, we are having mom report whether she completed a self-care activity as well as dad. And our process measure is how often did dad focus on the activity targeted by mom. So as we are the surveys, we are letting mom decide where she would like the father to help out more. So based on that activity targeted by mom. And once again, whether that's feeding routines, bedtime routines. Our disruptor measure is that father is unavailable for services. Our prediction, by encouraging families to focus on supporting each other as caregivers engaging in self-care, we hope to see decreased stress and increased overall engagement with the father and the family. So we have our touch point in ETO, and one of those touch points is the father engagement survey that's given monthly. We gave handouts to all the parents about self-care stress. As you can see, the different handouts on the different routines. So all providers, which I wanted to point out, we're small. We have one supervisor, one PE. So when you look at our data dashboard, that's one reason, because we have a little over 20 families. So we are targeting both the mother and the father. And so since we've been working on self-care for a while now, we reintroduced to the families that have been in the program the importance of self-care, and then are introducing the importance of self-care to any new families. But one thing we're finding is that they still want to think big when they're thinking of self-care. They're thinking of getting a massage, going and get their hair done, their nails done. And so we're hoping that's the reason that our results are not where we want them to be yet, because we're looking at the dashboards and we're having several mothers and fathers report that they're not engaging in self-care. So our next goal is to have them think a little on a smaller scale. For example, reading a book for 30 minutes could be self-care. Going for a walk is self-care. Exercising is self-care. Maybe you just put on a face mask and relax for 20 minutes. So I think they still have it in their head that they've got to leave the house and go do something, and that's not necessarily the case. So we're in the we're in process right now helping the families understand that it can be smaller than that and still be considered self-care. For example, going to bed early and letting dad do the bedtime routines would be self-care. So we hope to see our results increase by talking to them through that. Okay, I'll share any questions on the PDSA.
No, that's great. Thank you.
And our change theory diagram. Once again, the family has received curriculum about parent-child interaction, routine, stress, and self-care. Parents are encouraged to use the parent-child routines as a way to give each other self-care time. Hopefully the parent's stress is reduced, and ultimately, hopefully it's improving father engagement by giving a specific time that father can engage with the child while mother is engaging in self-care. Some of our disruptors, no father figure available. The father doesn't have time. The family doesn't follow through with the activity. That's where we're at right now. So that's what we're working on right now, is to get them to see that there's other things that could be counted as self-care. Is
Wonderful.
Mallory gonna?
Yeah,
Go ahead.
Mallory will share the data dashboard, and I'll talk through it again.
Okay, all right.
Mallory's got it. Perfect. Okay, so it's very similar, obviously, like you alluded to PCCT Safe Care. So we're seeing the same thing here. We're looking at dads and moms in terms of who is reporting doing this self-care activity. And as you said, Amy, it looks like we're seeing more families saying no than saying yes right now. So you're trying to shift that. And as you said, trying to shift it maybe in the direction of, let's start small, something basic. Don't have to shoot for getting out of the house and spending all day at the spa.
Exactly.
Mallory, will you head to the tables, please? Thank you. So we're seeing the same thing here. And like you said, I think the other piece is that you have such a small sample that you're working with that it is harder in that way to create change, because just a few families say no, and then it is hard to change those numbers as significantly. But we see mom doing self-care, dad doing self-care here, and then the reasons that they aren't. And those are presented in graph form as well. So you want to go to the graphs. So in terms of process, interestingly, yours compared to Safe Care, you do have divergence. So you have differences in moms versus dads saying whether they're doing those self-care activities, which is interesting. So it may not line up as cleanly. I'm wondering if the families are interpreting it differently for Safe Care versus your program in terms of having moms and dads not always report the same thing here.
Correct.
And how about the disruptor, Mallory? You want to show that one? So the two, it looks like, Amy, that we're seeing most commonly would be couldn't find the time, which again, that's kind of what we'd expect, right? If they're not going to do it, it's because they're struggling with time. And some of the parents also reporting childcare issues. So hard to do self-care if you have to be watching the kiddos. So those are the two main reasons right now, although it looks like couldn't find the time is the one most commonly reported by families right at this point. And the other tabs are related to father figure engagement. So we'll look at those really quickly. Look at the outcome. Yep, thanks. So this is tracking that some of father engagement items. So that main core measure of how often fathers are engaged in child rearing activities. And we're seeing it's pretty steady, although it looks like potentially there aren't as many dips down. So it's kind of maybe creeping its way up as we get over to April. And then do you want to do the other tabs too? Thank you. This is the number of activities that families have reported completing around those routines. So again, pretty steady, although potentially not as many dips down. And then, yep, those are individual items. So looking at how often dad is comforting the child or disciplining the child, helping with the child learn. And the disruptor is the father figure in the child's life, and is he available for services? And it looks like you do have some fathers who aren't available to receive services, so maybe fewer fathers available than total father figures in the picture, which I think is what we see kind of across a lot of programs.
Correct.
All right. Thank you so much. Any questions or comments for Amy's group? Amy, for your program, have you resumed in-person or porch visits or anything like that, or is it still all virtual?
Yes, we have resumed in person, and it's primarily in person now. Most of the families were losing interest engaging virtually. So
Okay. So Jem is back in the home with them most of the time?
yes.
How has she said that's been going?
Excellent. It's helping to increase the visits tremendously. So we're excited about that. They wanted her back in the home. So
I understand. Jem's a fun person to have around.
Yes, you want her on your side. Yes.
Yeah. Oh, that's great. Thank you so much for sharing, Amy.
Thank you.
And Dwan, it looks like you were able to join. I know you had another training back to back. Hi, Dwan.
Here. And I apologize because I do not feel prepared coming out of a training and coming into this. So I apologize ahead of time.
That's okay. That's okay.
It was
Just glad you're here.
So, so let me share my screen.
Sure.
So our project, our CQI project, is looking at the DAD2K, and we're just continuing on what we started last time. Our hopes was that we could get more fathers involved, but it's not really working how we wanted it to. The goal is to increase father engagement in the home visitation services, and just the overall increase of the father's engagement with their children. So we chose this to again increase the services by utilizing DAD2K. Smart aim was to increase father engagement by tailoring services to be more adaptable to father's schedule, and 20% of families with father figures will receive the DAD2K curriculum and report improvement in co-parenting based on families' reports and conversations. So before, we were just showing the videos and doing the curriculum with dads in session. And so with this project, we were opening it up where we could even just email them the videos, because really the DAD2K piece was the videos. And so just emailing that to them so they can review with their partner and they can have discussions around it. And then the partner can report back to us, or the father directly can report back to us. The weekly outcome was to track if mother reports improvement in co-parenting, and the process measure was to track if father received and viewed the DAD2K video on a weekly basis. Disruptor was, of course, just lack of fathers in homes to participate in DAD2K, and the number of active clients within a month who did not have a participating father would be compared to the number of active clients within that month. And so mother will receive the video and does not. The option also was we could send the video to mom and she forgets to share it with dad also, just because people are busy and they might forget to do that. Predictions were that fathers will be more willing to learn skills if videos are provided outside of session and can be discussed with their partner. From the last project, we were concerned that maybe having specialized curriculum for dad may put dads on the spot. So then would they shy away from it? And so we thought, well, this would be a way not to put dads really in the spotlight, but also give them those skills. So some things for us to do was to develop a new outline for the Dad 2K, just when to send the videos with the sessions. Ask mothers if they would like to share the videos with the fathers and then send the videos to each session, which just may not be my most up-to-date now that I'm talking about it, just because I know we also encourage sending it to the dad directly as well, if dad would allow us to send it to his email, because we thought we might even have more engagement that way too if it was directly sent to the father. But then providers would also either meet with the dad or provide a phone call with the father at least once during the program. So we would be doing this with all our providers, since we know it would be a small sample to begin with anyways, just not having very many fathers in homes anyways, wanting to make sure that we captured everyone we could. The target was to any father that was in the PCI module, the curriculum, PCI curriculum, which is our parenting piece, and that had not already been completed, because we wanted dad to learn these skills alongside the mom to really help in the co-parenting piece of parenting with our PCI curriculum. So we used the Dad 2K videos that were provided to the families, and we did this in consumer's home or over telehealth, which we now are pretty much fully back in the homes. There's a few situations where families may not be comfortable us coming to the home, which we're still doing telehealth, or if like the family is ill that week but still wants to meet, we can utilize telehealth in that regard, but everything else is in the home. And then we started it in February, and the plan is to wrap up June 30th. So like I said before, our goal is just to develop the outline and then have those communications with the moms and dads to see about sending the video to them if they weren't in the visit for the video. So that, and I apologize because I cannot find my change theory diagram. So I don't know if someone has it available to pull.
I can find it.
Thank you.
So Dwan, I was wondering, you said that you can send them to both mom or dad.
Yes.
Does dad have to give permission, or do mom have to give permission for those emails to go out? And are you finding cases where they're saying no, that they're unwilling to have the videos?
So the reality is, with all the changes moving back to just our agents, our program in whole has had a lot of changes over the last couple of months due to being back in the homes. We relocated offices, so we're now in a new building. I think staff kind of overlooked the fact that we can be doing the email part too, and they're really still trying to get dads to engage in the home visit. And so we readdressed that this week in our team meeting, like sending, if dad's not there, sending the email. So I don't have an answer to that, because I think staff just kind of, and all the change, has forgot that piece of it.
That makes sense, because when Andrew pulls up the data, I was wondering that when we were looking at it, because it seemed really tied to the visits.
Yes.
And I was thinking that that was something you had tried to get away from, was tying it to the visits and having it be more something that could happen regardless of whether dad was engaging directly in the services. Okay, that makes sense.
Yeah, so we are readdressing that and refocusing. I think just with everything, they were so used to the old way that they kind of forgot that, oh wait, we did change the direction we were going with this.
Yeah, that makes sense. Yes, your agency has definitely had a lot of changes over the last few months.
We are starting to get settled, and we're finding all these little things that we're like, oh yeah, we need to get back on course here.
That's funny. Lisa, while you're looking for that, I'll have Andrew pull up the data dashboard. We can go, unless you found it already.
I haven't found it. The newest one I have is from the learning session in January. Would that be the right one?
I believe so.
Okay, I'll pull that one up, but Andrew can go ahead.
All right, Andrew, why don't you do the data dashboard?
Sure thing. All right, so as Dwan mentioned earlier, unfortunately, I haven't quite seen the outcome we were hoping to see. So the ultimate outcome that we wanted to see was an increase in father's engagement in co-parenting as rated by the mother. We would ask our client mothers on a scale from essentially 1 to 5. It's on a scale of not at all involved to very involved. how involved is the father figure in the co-parenting of the child. And our hope was to increase those scores over time. And for this graph, we look at every family where there is a father figure in the family who's completed visits since we started this new cycle, and track the number of unique cases where the most recent measure of father engagement, as measured by the mother, is higher than their first measure. We're hoping to see at least 20% of our cases showing an improvement over time. And so far, unfortunately, we've seen 0%. And this blue line is our smart aim of 20%. And to get a little more detail, we wanted to drill down into this and see, all right, if they're not improving, then what are they doing? So thought about a couple different ways to show that. What I've landed on for the moment is this sort of trend graph. Each one of these bars represents summary within 1 week. We looked at each client's, within a week, we look at each client who had completed a visit in that week, look at their measure and divide it up into their a trend group. Is this the first time their involvement has been measured? Is their measure increasing or decreasing? Or is it holding steady at very involved, mostly involved, somewhat involved, very little or not at all involved? And obviously in this first week, we're seeing everyone is just getting their first measurement. Across time, we've seen few people actually decrease. And again, haven't seen anyone increase. That's not even showing up in the key here because no one is in that trend group. We're seeing a lot of people are holding steady at very involved. So it seems like there's a bit of a ceiling effect that a lot of these mothers are saying their father is as involved as they could be. They're very satisfied and they're just staying there from week to week. We've got a few individuals reporting saying very little, which is sort of the 2 out of 5. And those are the most common results we're seeing. So yeah, there's not a whole lot of change. And when we do see a few people change from one visit to the next, if there's any change at all, it's always been a decrease, unfortunately.
Is that because they start out high to begin with? And so maybe, like if they were already high, so there's nowhere to grow, and if the dad wasn't as involved that week, then it dipped down?
Yeah, that's what this yellow section of each graph represents. These are people who are holding steady. Their involvement level is unchanged at the level of very involved. So another said they're very involved, 5 out of 5, and it's staying there from one visit to the next. And we are seeing quite a bit of that. And almost everyone is staying steady. There's just not a lot of change from one visit to the next in the mother's reported involvement of the father figure. So that was the outcome of interest. We've got again, graphs of the, I'm sorry?
I was just happy to see, like, I like that graph because I think it gives us a good insight. And I know that we've been delayed getting some of the data to you just due to some
Technical difficulties.
Yeah,
Yep.
technical stuff, so.
Yep. Yeah, I think I'm fairly happy with it. I was talking with another group about possibly putting together a spaghetti graph, but those tend to be kind of busy and people seem not to like them as much as I do. It also displays case numbers, which I was worried about having visible in a report that is emailed around a lot. But I'm glad you like it. And yeah, this is the graph of our process measure. So we're trying to make sure that the DAT2K video was reliably being emailed to father figures. And we've graphed that from week to week, and it sometimes happens, but still seems fairly rare. I've got the same graph in a table form here, the count and proportion of fathers from week to week that were emailed the video. And seems those emails seem to be pretty rare, and they're not often watched, even when they are emailed. There's that as a graph. And this is the disruptor broken down by month rather than by week. This is the disruptor we're trying to get around. These are father figures that report at some point in the month, report saying that they're just not available to participate in a visit. And it's getting around this. They were hoping to email the Dad 2K videos to fathers so that even if they're not available, they can still watch the video. They still have a chance of participating in the Dad 2K curriculum. And that is still a fairly common issue, it seems. A lot of father figures just report just not being available to participate in the home visit.
Thank you so much, Andrew.
Thank you
Appreciate it. Any
for covering that, because that new graph, when I saw it this morning, I was like, I have no idea what I'm looking at. So thank you, Andrew.
Does that help when he went over it? Does that kind of visualization, is that a helpful type? We've been trying to create a way of presenting the data in a more readable format. And so we've been messing around with different options. And that was one that Andrew came up with that I thought was a really nice way to visualize the information, but at first pass might be hard to process.
Absolutely, but explaining it totally made sense.
Okay, good. Any thoughts or questions for Dwan's program? Thank you so much, Dwan. Appreciate the progress report.
Thank you.
Did you still want to share the change theory diagram, or?
You know, I think we're getting a little close on time, so we'll switch over now, but thank you, Lisa.
Okay.
And I'm going to turn it over to David for your talk.
Thank you, Helen, and thank you all the groups. I can't remember who said it. I think it might have been Steve Hahn. It's just, I'm always blown away with the amount of time and effort and energy that you pour into these projects. And, you know, I'm proud to be a part of this collaborative, even if I'm not as involved as I used to be. Thank you, Helen, for carrying the torch this go around. But I got to tell you, even when I'm off camera and I'm watching these stories, it brings a smile to my face. And kudos on the successes that some of you shared today. And I know others, it wasn't your turn this month, but I've been watching the all the learning sessions and all of your dashboards somewhat routinely, and just continually impressed with the quality of the work that you do and the care that you put into it. I wanted to go last today because, number one, I didn't want to steal any time away from your sharing of the progress under PDSAs. But number two, I'm moving in a slightly different direction. Rather than focus on father engagement for this talk, Helen and I thought it might be a good time for us to revisit more general family engagement, especially given the fact that so many of you are re-engaging with families after the pandemic has, you know, created this major disruption in their lives and your lives and in the program. So it sort of was an organic decision that was made, as I was describing to Helen, a direction that another CQI network I'm involved with has taken. I think I've probably mentioned on a handful of occasions that we're doing some consulting work with the tribal MIECHV programs that are run through the sister organization, funding organization, Administration for Children and Families. They have set up a coin network just like the HRSA MIECHV programs have, and I've been fortunate enough to be involved in that work for the past couple of years. They have two separate networks essentially running simultaneously, one focused on early literacy and language. I'm not going to talk about that one today, and then the other one focused on family engagement, which I am going to talk about. And it closely mirrors the work that our collaborative did, your collaborative, participated in just a few years ago before we transitioned to the father engagement topic. So I'm not going to tell you anything that you don't already know, spoiler alert. But again, I think it might be good timing for us to revisit our history, especially with this, the importance of re-engagement of families on the horizon as we transition back to more in-person visits and hopefully see this pandemic continue to decline and be less disruptive to lives. So let me share my screen. Okay, I think everyone can see that.
Yeah, we can see it.
So this week was the second learning session for the tribal MIECHV programs. They had just finished their first cycle or action period working on PDSA projects. And, just like our groups, it's amazing to see them really take hold of this idea and then sit back and watch some of the creativity that they apply to these very tricky problems of engaging families. Like many of your programs, they've seen significant declines in the number of clients that they've served over the last year. They've had to be creative in how they continue to engage with them with a hybrid approach of a lot of virtual visits, telephone visits, and some sprinkled in home in-person visits. A lot of their projects during this last phase were virtual oriented, but now they're planning the next PDSA and planning to do most of their work in person. A lot of the clients that they had pre-COVID have been on ice, if you will. They've been waiting in the wings, not doing anything, much of anything. Maybe some telephone check-ins, but no official visits. And now they want to re-engage them. And I think, as I've heard certainly from Helen and some of you directly, it sounds like many of our programs here are in the same situation, that we've got some clients we'd like to re-engage in. We've got some clients that we've lost during the COVID period, and we want to replace that capacity. So some of the material that was covered in the learning session I thought would be a helpful reminder for us. We began the learning session on day one with just an open discussion, and I wanted to try to replicate that here, even with time being short. This may be the most important part of it. Given all the transitions that you've experienced and given all the struggles to engage families and services, I'd like to hear from you that this is a unprecedented period, uncharted territory. There are likely to be things that you've observed over the last year that had not occurred to us back when we were directly focused on family engagement. So I'm going to keep quiet for just a minute, open mic period. I'm encouraging all to share one or two lessons learned over the last year on how to engage families. It could have something to do with the virtual environment. It could have to do with how you had to adapt your practice to be able to work in a hybrid fashion or virtually or whatever method it might have taken to continue to recruit and enroll during this period. I hope you'll feel comfortable sharing that. And if I don't hear anything, I'll certainly not be shy about calling names.
David, I will talk. I think that for my team, we realized how much engaging with the children in the home visits, being on the floor, playing with the children, doing those type of interactions, how much that helped with building the rapport and engaging with the parents also. Because the families that we were meeting before the pandemic, they were so excited when they heard we were coming back into the home. And even though we were still practicing social distance, we don't even feel like we're truly back to where we're, engaging with the children like we would have been beforehand. I feel like, I know I hear Dr. Beasley say this all the time, that there's some magic that goes on when we're in the homes. And now I feel that, because I'm like, yeah, we miss that piece. Not being there in the homes with the children. I think the parents open up more to us when we're face to face with them than virtually also. And I think a lot of that's just that they see us interacting with their whole family in a real way. And so it makes them just more comfortable with us all together.
Yes, thank you for sharing, Joanne. I heard something similar in the learning session this week with the tribal MIECHV programs, that it was really hard to model the parent-child interactions that you typically would. It's a core part of all of our home visiting programs, and keeping people in the camera angle so that we can see what's going on while also trying to coach them was near impossible. So you're right. I think that's where the magic happens. I have a little bit more to say about that if time permits at the end. So great example.
Dr. Omar, this is Patty.
Okay.
I think that in our case, I know that going to the home is nothing like going to the home and being face to face, but I think we learned that families need support and want support, and it didn't care if it was, you know, via video conferencing. At the beginning, we were really scared, thinking, oh my gosh, I don't know how we're going to do this. And it was a huge transition for everybody. But we realized, you know, I mean, we were like, there's no way that you're going to do a home visit for an hour. And, you know, the visits were like plain and simple, even an hour and a half, you know, the same experience, safe care, the PAT, and in a way, families adapted, you know, to that, that they enjoyed even the visits, you know. So to me, the most important thing, it was that connection. It didn't matter if it was face to face, but even this way, they felt that they were supported. And I think we graduated maybe like 45 families. I don't remember how many safe care, maybe Cynthia remembers, but we did enroll that many, you know, during this time, even if, you know, through video conferences, started the visits like that. So they don't even know what the real visits are. So that's going to be a different transition now going back, because they don't know what that's like. And some, they were interviewing one of the moms and the parents as teachers program for a video that they were going to present in that way. And it was funny to hear, because that's one of the moms that started this way, and she just was calling it not home visit, but my lesson was this, the lesson that so, you know, even the description of the program, the way they view it. But to me, you know, knowing that the families felt that they could still have someone they could ask questions, and especially with this, like, I don't understand. I mean, and everything, what's COVID and what to get the vaccines, or what to, you know, what to get testing and what to get resources. I mean, all that, it was still so crucial and important that we didn't see that much turnover. I think it was at least 95% in PAT that we maintained the families, and we graduated a lot, but we, you know, also enroll a lot of the families. What affected us, it was that we used to have a huge waiting list, and we don't, and maybe we're not in full capacity in safe care, but close to, you know, maybe with 5 more families will be in full capacity. But it's more that the outreach was a little harder, just because our agency was close to the public, and that's where we get a lot of walk-ins, and you can go to, you know, weeks and the offices. So that was hard for us. The outreach was harder, but already engagement and maintaining families, not as bad as I thought.
Yeah, that's great to hear. It's amazing how resilient your programs are, and how resilient some of these families are. I think it speaks to the value of the programs that you offer, that even with all of these changes and adaptations, they did not want to lose this service. Okay, other ideas, please keep them coming in the chat window. I'm going to move on to the next slide. And let's review some of the concepts that we've talked about in the past being related to family engagement. Now, a lot of this is going to be data collected and reported on pre-COVID. In fact, I think all of what I've got here for you today is pre-COVID. One of the reasons why I wanted to start with what might we have learned over this last year, and might we see in the literature in the years that are coming ahead. Tribal MIECHV, just like we do, they've got a key drivers diagram with primary and secondary drivers. Here you see some that they're working on related to family engagement. We did a rundown of some of the findings from the literature associated with greater engagement, and then some of the findings in the literature, some of the characteristics that lead to more disengagement. Again, this is review, and you all know this. I'm just going to highlight a few of these. Notice the top 3 are related to stress. And we decided for this past learning session to emphasize stress, knowing that everybody's had to deal with a higher level of that this past year than they're accustomed to. And also knowing that traditionally our home visiting programs, this is a big factor in their lives, right? The amount of stress that they experience. Many of them are first-time young mothers and fathers, and struggling to know how to be a good parent. So of course, that's why they're attracted to these programs. As we start to re-engage with these families, I think it's a helpful reminder to emphasize that service that you're providing, that you're identifying and addressing stresses in their lives, even some that maybe they're not fully cognizant of, and that you have solutions for them. The program has solutions for them. We have found in our past work, I'm getting ahead of myself a little bit, but you'll remember, some of you that have been around for a while, when we worked on best practices together for a CQI approach and not the COIN network, that promoting stress reduction was a best practice for increasing our enrollment numbers. That when we go to pitch the program, that's something we definitely want to emphasize, because potential clients pay attention to that. That's what they want, particularly young moms, young fathers, especially if this is the first time they've had to go through raising a child. One of the other things I want to highlight here that's not on the slide is what we've observed that does not predict family engagement well. And I think it's interesting to note that when you look at family characteristics, like the age of the child, the number of the children, the age of the parent, their social economic status, even things like history of mental health or substance use issues, these factors have not consistently predicted family engagement in services. So every once in a while, we'll see a study that finds a significant effect, but it's not been consistent. And I think that's promising news. What has been more consistent, what has been a more robust predictor of family engagement in services are program characteristics and provider characteristics, or provider perceptions and orientation. That's good news for us, because those are things directly under our control. Those are things that could be built into a CQI PDSA, for example, worked on and used to improve our engagement numbers. A couple of other things to highlight here: home visitors who are knowledgeable and skilled about relationship strategies, community relationships, social strategies. That's, again, provider characteristics are a key indicator of family engagement, key predictor of family engagement. When that home visitor and that parent relationship is strong, we of course tend to see the family engagement and retention numbers, for instance, be much higher. What we've observed, and one of the reasons we pivoted to father engagement for this last learning collaborative, is that families want broader involvement in the program, and that there are a good number of families who want the fathers or the grandparents or whoever else, a caregiver that's in the home, to be incorporated in the model and not just the primary enrollee. In terms of factors that are disengaging, and some of the things that we thought would be worth highlighting coming out of this pandemic, top of the list here is those who experience isolation and disconnection. And we suspect that this is at an all-time high right now, that because of the pandemic, being trapped in your home, if you will, more frequently than you would otherwise, a lot of the clients that you are either serving now or potentially will recruit in the year ahead may be struggling with this issue. Something to be cognizant of, something to address perhaps as you recruit and as you work with these families. We do know that there are a lot of families out there with a strong sense of privacy and caution about relationship building. Again, getting ahead of myself a little bit, revisiting some of our findings from the best practices work, building rapport with these families in the first few minutes of every visit, not just in our first few visits. We found that to be associated with higher retention numbers. So we classified that as a best practice. And I think it's because the relationship building outside of the curriculum content is just as important, maybe even more important, than going through the content of the curriculum. Experiencing crises and adversities, significant stress and trauma, as I said before, this was an emphasis in the learning session this week, and things to be cognizant of. One of the findings from the literature has been that stress is a predictor of engagement and disengagement, and it often falls back on, or often comes down to, the perspective of the provider. So if a provider observes a family struggling with engagement and attributes it to, well, this family just doesn't want to be here, it's hard to hide those feelings and those emotions, and that may actually exacerbate the problem. But a provider who recognizes that here's a family struggling with engagement, they've missed a few visits recently, this may be a telltale sign that there's some added stress in the family, and I may not be fully aware of it. That's a completely different perspective. And in the past, what we found is that recognition that that perspective on family struggle is a predictor of greater engagement. So it reminds me of the ever popular adage now coming out of the ACEs literature that rather than asking the question, what's wrong with you? And let's ask what's happened to you. So same type of, I think that can be translated here to family engagement. When we observe struggles from a family, why is that? And is there some added stress here that we can potentially probe and help address? Many of these others are built around the relationship again. We have many of the primary drivers. I showed you just a few a second ago, one of those a second ago. Many of the primary drivers are focused on building a goal-directed relationship with the family. And so you see elements or traces of that here in a lot of these disengagement elements, that being cognizant of the relationship that we build, recognizing when it's not going well and trying to repair it. For what it's worth, these programs are actually collecting the worker alliance inventory from all of their clients and using that as sort of an indicator of how strong the relationship is, using it as an indicator of when the family might be prone to attrition, might be leaving the program. Interestingly enough, we here in Oklahoma collected that same measure. You all were part of that in a past MIECHV study, and we collected it with our external data collectors as well as providers of your programs. I have a slide here I was going to share with you. This is my setup slide. When the first COIN program was developed, family engagement was the very first topic that they tackled. And they set some pretty lofty goals of what they wanted home visiting programs in that network to reach. You may recall we had these as goals for our first family engagement learning collaborative. You see our actual numbers here back in 2015. These are client retention numbers. And I don't know how well you can see this, but there are gray circles with X's in them that represent the targets from that first COIN network. So at roughly 3 months, 90 days, they were hoping that programs would retain about 80% of their clients. At about a year and a half, they were hoping that it was around 70%. And then way out to a year, they were hoping to retain somewhere in the neighborhood of 60%. What we found is that these are really hard benchmarks to hit. These were our numbers pre-learning collaborative. We were able to see an increase, a slight increase during our learning collaborative action periods, but we did not reach these benchmarks. I'm going to come back to this in just a minute. But what I wanted to share with you is the data that was collected on the Working Alliance inventory. We took a pretty deep dive into that. And one of the things that we found is clients who reported high levels of alliance, strong levels of alliance with their provider were retained in the program significantly longer than those who reported low levels of provider-client alliance. The blue line that you see here are families that reported a WAI score above 70, which is in the top third of the range there. And then the red line is everybody else. And you'll notice there was a pretty significant difference here. These are days in the program at the bottom, and then on the vertical axis here, you see the probability of staying with the program. And so the red line, it drops pretty drastically. Here we are at 6 months in, and we've lost half of our participants among those clients who reported low alliance with the provider. Among those clients who reported a high alliance with the provider, we're above the benchmark that was set for COIN. Same thing was true at every one of these points, so the 3 month, the 6 month, and the full year. We've been challenging the tribal MIECHV programs to come up with ways to use the WAI in practice. And some of them are now going to tinker with incorporating that in their supervision, looking at scores from their clients either provider rated, or a few of them are actually getting anonymous aggregate data coming in at the program level, and then using that to address which items are doing well on and which items are not doing so well on. So food for thought, again, as you're thinking about re-engaging with families this next year. I think there are a lot of ideas out there without having to look beyond our state boundaries, without having to look beyond our learning collaborative boundaries, for ways to improve engagement with our families. I know it's a daunting task, and you're an upbeat group, but I'll be a cheerleader anyway. I just want to encourage you, to go back and look at the successes we've had in the past in this area. I highlight one here because it had to do with stress directly. And again, that was the theme of our tribal MIECHV learning session this week. This was our PAT Bethany cycle 3 PDSA, that very last action period. And they had a self-care, just like they do now. They had a self-care plan in place. They had assessed the parent stress before and after engaging in this self-care plan. And they found a significant decrease in stress among the parents who participated. So lots of opportunities here for re-engaging with these families and recreating these successes from the past. And again, we know it's possible because as a group, we've accomplished it before. More reminders. I've hinted at the best practices. Probably most of you are aware of this. I'll be honest, I wasn't fully aware that the other home visiting programs managed by our health department in the state are still using our best practices guides. Maybe some of you are as well. And they're building CQI projects around some of these still to this day. So I think they ring true as much as they did 4 or 5 years ago when we were tackling this problem. I think they ring true today just as well as they did back then. So I thought a review would be helpful. There are a lot of them, as you recall, so we can't talk about them all in the next 9 minutes. Let's skip through some of this. But I'll circulate these just in case you don't have them on file still. And again, as a good reminder and a good encourager of ways to re-engage with your families or engage with new clients as we start to crawl out of this pandemic. I'm just going to highlight some of my favorites here. For those that were around back then, or for those that weren't around back then, we had concentrated on 4 types of engagement for our best practices work. We had some tips for how to increase our referral traffic. We had some tips for how to increase our enrollment numbers, tips for increasing how many visits we complete with active clients, and then tips for increasing retention or not losing clients, minimizing dropout. In the referral category, here's one of my favorites, and it was probably the most robust predictor that we observed when we were studying this. Seeing it will make a believer out of anyone, including referral sources. So this was a principle for increasing referrals, that your referral sources really need to see the program if they're going to be one of your top referrers. Well, how can they see it? If you're lucky enough to get permission from your supervisory team and your agency directors, you can take them on a visit, and I know several of you do that. If you're suffering, your referral counts have gone down of late, or maybe one of your top referral sources is not producing like they traditionally have in the past, and we observed this when we were working on this project together, it may be time for a revisit. It may be time to take some of those key personnel from that referral source on another visit. I think they'll be easily convinced to do so, but you might remember we had our best practices split up into principles. Those principles were applied through techniques. Sometimes a technique was an actual script. So here's a script trying to convince a referral source to go on a visit. I can tell you about the program, but truly seeing is believing. For enrollments, boy, this is one that always seems to rear its ugly head from time to time, these myths and misconceptions about our programs. So coming out of the pandemic, this might be one that we need to revisit more closely. Families may be more leery about having people come back into their home after the pandemic, and particularly families that feel like You may not be who you say you are. Those who are very cautious about in private, as we talked about earlier. So, you know, the one myth that we've always heard about home visiting, and that is that we're coming into the home to take children away. That's one that we encourage folks back in this best practices CQI network to face directly, to combat head on. Get it out there early. I'm not with DHS. I'm not coming in the home to take your child away. This is a parenting program. We want you to succeed as a parent. And then get in that door. It's hard, but emphasizing aspects of your curriculum is one of the things that we notice works the best. So the stress reduction that we talked about earlier, the flexibility of your scheduling, the convenience of being able to do this in the home, or maybe even a hybrid approach where you can offer some of these by telephone or by Zoom. Those are things I would definitely mention early as we're trying to get our enrollment numbers back up. The ability to change educators if that's something that's desired, or if that's something that your program does. That may be something that's on their mind at the beginning. Not to say we would encourage that behavior. More often than not, what we found looking back at the data is that when the educator or the home visitor changes, our attrition numbers go up. So typically that's not a good idea. But it might be something on the family's mind, particularly when they're ready to consider enrollment, that they want that flexibility. Here's one of the scripts around emphasizing aspects of the program. So being a parent can be scary and overwhelming. We're here to help overcome those fears and feelings of distress. We'll cover tips on how to reduce stress, improve your health and well-being, as well as proven parenting and education techniques that ensure your child is on track to learn and grow. This was, we had follow-up scripts later that were a little bit more specific, and we encouraged programs to tailor this around specific activities that you do. So if you're an NFP, a Children First program, and you weigh and measure the child routinely to make sure that they are, and show where they are on their developmental curve, that's something that was highly attractive to families. So I would promote that early. And other specific aspects of your program that you think address parenting or stress, I would say it very much explicitly at that stage of trying to get a new enrollee. Completed visits. This one was not anticipated, and I know it's a struggle for some programs to make this feasible, but there were two providers in the state that stood out above all others in terms of their completed visit ratio. How many scheduled visits did they complete? And they were outliers, positive outliers. We interviewed both of them. They were in two different regions of the state, and they told us virtually the same thing. We use, and they didn't call it this, but they use this open access scheduling approach. So as we're starting to do more in-person visits, and it's not as convenient perhaps to be doing virtual visits, I thought it'd be a helpful reminder that being open the week of a visit seemed to be a best practice when we studied this intently a few years ago. Calling up on a Monday, all of the clients I have scheduled for that week, and scheduling them for their day and time. I know it's scary, but for whatever reason, the data seem to suggest this is a best practice. Here was the exact, or some of the elements of the technique that was being used. So they reserved office time on Monday to schedule that week's appointments, reserved Friday for their makeup appointments. Reliable clients were booked in advance, so it wasn't all their clients. And they, if they felt comfortable that this client was going to make the next appointment, they would schedule it at the previous visit. But for everybody else, they would call up on Monday and say, hey, I'm giving my visits this week. Which day works best? And try to do 2 on Monday, 4 on Tuesday through Thursday, and then 2 on Friday, keeping Friday open again for any makeup visits that week. All right, finally, attrition or the dropout. How do we prevent that? This is an interesting one too, that we heard from some of the top performers, that clients are continually probing for evidence that you can tell we did this with PAT last, but that a home visitor does not care. This is where that first 10 minutes of building rapport is so important. And in that period, the amount of information that you can retain and then talk about with the family that occurred previously. So what you learned from the last visit, what you've learned cumulatively from this family up to that point, revisiting that in that first 10 minutes so that they recognize they're not just a number, they're not just a client on paper. This is a family that you care about, you've studied, you want to see them succeed. And it may not have to do those, again, that 10-minute conversation may not have to do with the curriculum for that day, but you're trying to establish and strengthen that relationship, show that you care. We found that to be a best practice. Supervisors, and I think we have mostly supervisors on this call. One of the things we heard from supervisors from top performing sites in terms of dropout was that they would share stories of late blooming clients who were a little reticent at the front end, but then had these fantastic successful graduation stories in the end. That helps motivate the providers to care even in times of struggle, even when they're worried that the client is disengaging. Remind us of the literature finding of perspective that as that's happening, what might be causing that? Is it some stressful event in the household, and can we probe deeper on that rather than let it affect our personal mood or our outlook on this, on the possibility of keeping this family engaged? Okay, I can tell we're over time. I want to leave you with Jim Mold's perspective. Dr. Mold, those who were around when we were doing the best practices work know that we completely lifted this from what was being done with our family medicine partners. And Jim was so kind to translate it to home visiting. He went on some qualitative interviews with Lana and I, and he actually sat in on some visits from some of your programs. And that was the data that helped devise the best practices we just reviewed. And he's not much of a cheerleader himself, but he gave a rah-rah speech that I've kept on file here. He was born and raised in the 60s, so I'll do my best to imitate Jim here. These are some findings, or these are some mantras, I should say, from children of that era, and how he liked to motivate his family medicine practitioners who were involved in CQI as well. That just because we've always done it this way doesn't mean it's the best way to do it, and be open to change. We're all in this together. We can make the world a better place. Each of us can have an impact. If we can work together, we can achieve anything. And again, you're an upbeat group. You're obviously doing very impressive work. That I mentioned the smile that you bring to my face each time I see these projects reviewed. So really just a pat on the back here. I think he had another one too, but he said he would cross it off the list. It didn't apply anymore. He gave this talk to us when he was in his 60s. So he said he's abandoned this 60s mantra of not trusting anyone over 30. But keeping your eye on the prize. I know you all do this. In the learning session with the tribal MIECHV programs this past week, it was great to see some of their families who agreed to share photos, and even during these tough times, to hear the successes that were coming out of the pandemic, and the resiliency and the adaptability of those programs. It was very inspiring, just as were the reviews of your programs today. So kudos for all the work you do, and as technical assistance folks, so to speak, for the PDSA projects that you're working on, please do not hesitate to ask us for assistance, certainly on the father engagement projects that you're working on right now, but also as you start to re-engage these families, maybe not in a defined PDSA way, but certainly in an intentional way. Let us know if we can be of any assistance. Okay, Helen, I'll stop there.
All right, perfect. Well, I know we're a little over time, so I'll just say that Lisa will be sending out doodle polls for groups that are doing rounding calls, and we'll let you know who's doing the rounding calls, who's expected to do a progress report for next time, and then we'll send out a doodle poll to everyone to schedule the May call. But thank you for being here today, and we'll see you next month. Thanks.
Thank you.
Thank you.
Thank you.